What is up, everyone? How are you doing? This is the 419 Time Podcast. I'm Zach.
I'm Evan. Today we have a special guest joining us, Ashley Evans.
Woo!
Thank you so much for joining us, Ashley.
Hi, thank you. I'm so excited to be here with you, Zach and Evan.
Yeah, we're happy to have you on. Today we're going to be talking about mental health. There's nobody better that we wanted to have on other than Ashley. So we're going to let you introduce yourself a little bit first, and then we'll ask you some hopefully not too challenging questions.
Okay, I love it. Thank you. So my name is Ashley Evans. I am a psychiatric mental health nurse practitioner. I have been a psychiatric nurse since 2016. When I entered the field of psych, the very first day, I knew it was home for me. I have been in several different types of nursing specialties. Started out in the NICU, taking care of itty bitty babies. Really enjoyed that, but it wasn't home. It wasn't my calling. So I did it for about a year, then moved on to a rehab, did that for about 2 years, and went back to well baby, went to well baby thinking I need to just get back to the babies. But it still wasn't it for me. There was this nag, there was this tugging at my heart saying, you still haven't made it home yet, sis. So I remember looking online at our community hospital and seeing an opening for psych. And when you're in nursing school, people always tell you, don't go to psych, don't go to psych. You go there to die, And I'm like, should I do it? And I've always loved psych. And I was like, you know what, I'm going to do it. And the very first day, I was like, my God, why did I not come here first? But I'm actually so glad I didn't. I'm glad that I got a taste of everywhere else so that I could truly know and understand where I was meant to be. There's no greater feeling.
Yeah, that's awesome. You were telling us a little bit about your family as well, so I'll let you brag on them for a little bit.
Absolutely. So I'm married. My husband, he works for Baylor University, and I have 2 sons. One is 16. He plays football. He plays baseball. He is all things athlete.
Can't relate at all.
Yeah.
I know you guys are athletic too.
Oh yeah.
But so he's looking at schools, looking at where he wants to go to college. It's a very exciting time for him in his life right now. And my 6-year-old, he's in a whole different space, but it's also exciting for him. He's about to finish first grade and he loves sports as well. He plays football and plays baseball. He walks in little brother's footsteps very closely, and 2 dogs, Ziva and Zoe. I can't forget about the little ladies at the house either.
Awesome.
More dog people on this episode. That's what we like to see. Dog people all the way. So you created this company called PyschLife Tee, and I just want to hear more about why you started it, or what is it, why you started it, how did you even want to grow this? What was your kind of vision of this?
Sure. Thank you so much for asking. Well, as I said, I started in psychiatry back in 2016. And actually, my first unit that I ever worked in was an adolescent unit. And in that unit, I learned so many things about myself, but more importantly, about the clients. And one of those important things that I learned is that, mental health, patients who deal with mental illnesses, they think in a different way. They think very down about themselves. They think everyone else is thinking down about them. They think they're not worthy of love, that they are not loved. They believe that they're an embarrassment to their friends and their family. They are ashamed of themselves because of the diagnosis. And they really carry a high sense of stigma in terms of how they feel about having this diagnosis. And that weighed on my heart so much, right? And I was thinking to myself, well, surely when these people get older, they won't think that it'll get better, as they age, that this is something that they were dealing with because of being a teen. And you know how when you're a teen, you're so impressionable, you want to fit in, you want to do things that your friends are doing, you don't want to take pills. And then a year later, I moved to an adult um, unit. And when I moved to that adult unit working with veterans, I noticed that the veteran clients that I served had the very same thought process. So, what that told me is that this is something that runs the gamut. This is not something that is just in a particular population. And then when I recalled my very own experience with mental illness, because when I had my first son 16 years ago, I developed postpartum depression. So when I started, being retrospective about my own experience, I identified that I felt the same way. I didn't want to go and be seen by a doctor. I was like, go see a doctor. Like when my husband told me I needed to see somebody, I was like, I'm not seeing anybody, like I thought that that was weak. And I even said that to him, that's weak. Especially in the Black community, these are thoughts that we have. And that's because we don't come up with the topic of mental health being normalized. And so when I created PyschLife Tee, it was to normalize the conversation of mental health by giving people something that they can relate to, something that they can see and feel like is beautiful, feel inspired by, motivated by, something that lowers their anxiety and makes them feel less guarded. And what more can do that than a beautiful design that's adorned with, beautiful words and nice letters and beautiful colors for the tea designs or the accessories. And I thought that it was so awesome to do that on a tee because, I'm a football fan and I know you guys are too. But here's my thing, I'm from Auburn, Alabama. If you saw me with an Auburn shirt on and it had a Nike check on it, you would understand two things about me. A, I love Auburn. B, I love Nike. So when you relate that to mental health, what a mental illness patient will understand about you having that on is that you feel like this is more than a job. Okay. You're not here to collect a paycheck. You're here to invest in people. Okay. You take your job seriously. And so when they see that shirt and you having it on and wearing it with pride, they feel more apt to be honest, transparent, to lower that guard and really have a meaningful conversation about their journey and mental health and mental wellness. And that is what I want. I want people to feel less guarded. I want people to feel like, you know what, I matter. People really do care about people who have mental illnesses. They don't look down on us. They don't feel like we're, you know, inferior to them. That's not what we do. We feel the opposite. We believe that people who struggle are warriors and we want to walk along beside them and help them.
Yeah, that's
Wow,
so good.
that's really good. That's very good.
Very good. Just the words that you said at the beginning of people who have mental health issues or they have mental illness, that's the exact things that we like, almost the exact words that Zach said in his testimony of how he felt before his suicide attempt.
Mhm.
And when we had previous episode as well with Sierra, those are some of the same things that she felt in her battle with having suicidal thoughts. Riley and Cheese, the two guys that we had on our disability awareness episodes, they said the same things. When they were bullied, they felt those things. And so how do you see in your profession with the VA, but also with the PyschLife Tee, how do you see mental health issues, mental illness, and suicide, are they, I mean, they're two different things, but where is the cross? How do you see that?
People who suffer with suicidal ideations, they can have two different reasons for going through these ideations, right? There can be people who have experienced something very traumatic, and in an instant, they feel like the best case scenario is for them to die of suicide. Okay. But there are other people who have this chronic suicidal ideation where they're always battling, because of the depression, because of the anxiety, because of the bipolar symptoms, the schizophrenia symptoms. They always battle, this voice inside their head telling them they're better off dead. And, certainly with any population within mental health, that's something that you have to talk about. It's something that you can't, you cannot pretend that it doesn't exist. It's a part of every single conversation that I have with every single person, because it's extremely important. You can literally have someone who, walks in and presents well and looks like they're doing well. And then the next thing you know, they've died of suicide. Luckily, that has not happened to me in my journey. Praise God for that. But what I am saying is that it does happen. And if you don't ask, you never know. That could have been an opportunity where they would have come forth and said, you know what, I am dealing with suicidal ideation. This keeps happening. I keep seeing myself in a pool of blood. I keep seeing myself X, Y, or Z. When people do that, that's a great opportunity for you to pull in suicide prevention coordinators, for you to pull in social workers, for you to look at them maybe going in inpatient to get their medication stabilized or get them away from, the outside factors that they could be dealing with. Because there's one good thing about an inpatient facility. It literally takes you out of your environment and puts you somewhere else that's controlled. And I don't say it in a negative way, it's very positive, because you have lots of therapy going on. You have lots of routine going on. And oftentimes, a person who does become suicidal, their life has become hectic. There's so much anxiety. They don't know left from right. It's just too much for them to handle. And when they go into a facility that has an inpatient unit on it, they really can take some time to just step away, allow themselves to be absorbed in, the process of the unit, and really dive into the hard work of doing therapy, which is difficult. But when you start that therapy, it definitely helps you to get to the other side of the suicidal ideation, where you can understand that that is not, the option that you should take, that life is what you should take, and that you can live a healthy, joyful life, with getting on the correct medications, with implementing other things such as yoga, meditation, mindfulness, prayer, implementing exercise, implementing nutrition, good healthy vegetables and good healthy fruits, just making awesome wise choices in terms of your food that you're taking in. And in addition to that, simple things like going outside even helps our mental health, because it lifts your mood, it elevates your mood. Those are things that we routinely talk about and get people to understand the importance when they're in mental health inpatient facilities.
Yeah, that's so good, and just such
Yeah.
good reminders and speaking truth right there. But well, Ashley, thanks for coming on. Check us out in the latest videos, because we're going to be wearing some PyschLife Co. merchandise. It is amazing, some really cool merchandise. The link to her website is going to be in the description below, so definitely go check her merchandise out, because it has great truth on it with some really cool designs. But
yeah, super excited to have Ashley on. Thank you again for being willing and for sharing that with us. Mental health is, a lot of people struggle with it. And like you mentioned to us earlier, creating the openness and just being vulnerable and talking about your own struggles, your own history can really help people feel like they want to talk about it and give them that space to know that they can. So we acknowledge that. If any of you that are listening need to talk to somebody, reach out to us, reach out to Ashley. I know that she'd be willing to connect with you guys. Yeah, just seek out that help. Know that people are out there. We love you. And yeah, thanks for joining us. Again, thanks, Ashley. I'm Evan.
Zach.
Thanks for listening to the
I'm
419
Ashley.
Podcast.
See you later, guys.
Bye.
Thank you.